and welcome to A Sense of Wellness podcast, inspiring and empowering a healthier you. I'm your host, Susan Greeley, and I'll be diving deeper into the 4 pillars of wellness: sleep, exercise, nutrition, and stress management. Today, I will be talking with my guest about how to take a proactive and holistic approach to preventing the #1 killer of both men and women, which is cardiovascular disease. I'm honored to be joined by Dr. Suzanne Steinbaum, who is a leader in preventive cardiology. Dr. Suzanne is founder and CEO of HeartTech Health, which is a medtech innovation company whose mission is to decrease the risk of women's cardiovascular disease and bring prevention to every woman, regardless of location or circumstance. Dr. Suzanne launched heart prevention programs at Mount Sinai Heart, Northwell Lenox Hill, and Beth Israel Hospital in New York City, where she now works in private practice, as she also runs her company. Dr. Suzanne published Dr. Suzanne Steinbaum's heart book, Every Woman's Guide to Heart Healthy Life. She has been a national spokesperson for Go Red through the American Heart Association for 18 years, and she serves on the National Medical Advisory Board for Peloton. She is also a frequent guest on notable shows, including The Today Show, Good Morning America, Oz, The Doctors, and more. Dr. Suzanne, it's truly a pleasure and an honor to have you with me today.
Thank you. Thanks so much for having me.
Yes, thank you as well. I'm very excited to get our conversation going in hopes of educating people about heart health. It's just so important, as you know, has a huge economic and social impact on all of us. And the goal is really to empower people, particularly women, to take steps to prevent heart disease. So I know that about 80% of all cardiovascular disease is considered preventable, right? I mean, that's incredible. So we're going to really dive in there.
I have to say the statistics that I talk about a lot, and I'm just going to talk about women for 1 second.
Okay. Mm-hmm.
We know that 1 in 3 women die of cardiovascular disease. 1 in 33 will die of breast cancer. When you ask women what her greatest health threat is, we all go to the breast cancer story. And the reality is heart disease is her greatest health threat. Here's what's scary. 70% of the time, she doesn't know that she's even sick. Wow. And 80% of the time, it's preventable. And I think that's what's so really empowering for all of us to know that 80% of the time, there's something that we could do. So let's figure out how to do it, and then we don't have to get sick.
I completely agree. Let's do it. I focus on this all the time, cardiometabolic disease and prevention and helping people, because that is empowering. And that is going to be our biggest message, is how we put the power back in the individual to make changes in their daily lives, their daily lifestyle habits to prevent this really critical disease. It covers a lot. We're going to talk about cardiovascular disease in general. And I think even that's misunderstood when we talk about heart health.
I think you're right.
Yeah.
But the most amazing thing is if we prevent heart disease, we're preventing blockages in the arteries. And there are arteries from head to toe. And so when you prevent heart disease, you really prevent multiple other diseases that are chronic illnesses. And so heart health is essential to overall health.
Okay, so all that said, I'm going to take a step back because I'm so interested in how you got to where you are today, to be honest, Dr. Suzanne. And being the CEO, typically a preventive cardiologist doesn't necessarily have this path to becoming a CEO of a medtech company. So I would love to hear more about your own story and your journey.
Yes, it wasn't really what I thought when I started, but I will tell you the story that I've repeated so many times because, Oprah talks about that aha moment, and this was mine, and it absolutely changed my life. I was in training in the emergency room, and I was a resident. I didn't really know what I was going to do. And there was one day a 53-year-old woman was wheeled in. She was clearly sick. She was sweating. She was clutching her stomach, her chest, kind of writhing in the stretcher. And she was evaluated by the doctors in the ER. Now, I was one of those students who absolutely revered the doctors, the attendings. I just took notes. I followed them. I mean, I was just that kind of student. And here the doctor evaluated this woman patient, put her in the corner with the diagnosis of gastroenteritis, and she proceeded to have a heart attack in the emergency room in front of us. And it's like Everything slowed down. I looked around, looking at everyone like, how does this happen? How are we letting this happen? And the craziest thing that happened was no one else was as upset as I was. And it was back in the day. It was 20 years ago, plus, I think. And they kind of said, women don't get heart disease. I'm like, but they do because we keep seeing it. Mm-hmm. And I was really interested in what happened to these women when they went up into the hospital, to the floors. And I saw that the women didn't do as well. And this became very, very clear to me that women got heart disease. We didn't pick it up. We didn't diagnose it. We didn't treat them the same. What's going on? And I decided I wanted to do a Women in Heart Disease Fellowship. And I went to the chief of cardiology and I said, want to do a Women in Heart Disease Fellowship. You know what he said? There's no such thing. And then I thought, okay. So if I can't do that, if I do a preventive cardiology fellowship, then I could prevent women from getting heart disease and then it'll be okay. So I went to him and I said, I have another idea. Can I do a preventative cardiology fellowship? And you know what he said?
Oh, no.
There's no such thing. There was no such thing. And so I was lucky enough to be in the right place with the right mentor at the right time. And I did one of the first preventive cardiology fellowships in this country. And it was at a time where talking about stress was silly. It was a time when talking about yoga and meditation was kind of flaky. I was really in this space of trying to break the rules. So in some way, being the CEO of a femtech company, I've been breaking the rules for a really long time. But my career did start in being the director of one of the first women in heart health programs in the country. I did that at Beth Israel. I was the director of the Center for Cardiac and Pulmonary Health, looking at the effects of stress on the heart way back in the day. And then I went to Lenox Hill, ran a program there, Mount Sinai. And here's what happened. 20 years ago, I was saying 1 in 3 women died of heart disease. 20 years later, as a spokesperson of Go Red for Women, I am saying 1 in 3 women die of heart disease. I know this is preventable. I know how to change this. Either I was going to stay part of the problem or I was going to leave and become part of the solution. And that's how I became the CEO of a tech company.
I'm here saying, I'm cheering you on. I don't know. I wish listeners could see, but I'm like, yeah. And thank goodness for that journey, for you saying, I am going to break the rules, because it's not acceptable to have those same statistics, right? Like, we need to do better. We do. And when we look at women and why this is happening, more women are dying of heart disease than all cancers combined. And it started in 1984. And when you look at the studies today, there is literally an unconscious bias that goes on. So how do you get rid of unconscious bias? Technology. The power in technology. And I never thought of myself as a tech person, but I always thought of myself as somebody who was going to try and figure this out. And we're in the time right now of femtech, who knew there would be such a phrase out there, technology that focuses on women's health issues. And I'm grateful for being where I am at this time where we can make a change and have that kind of impact. I have goosebumps because it really is a pivotal time in history. We're coming out of the pandemic. So I'm going to dive right into some of these pillars, my 4 wellness pillars. Today, I really want to hone in on the stress that you mentioned. And this is so important to talk about and make people aware of. I say, for both good and bad, stress can move mountains. Stress does unbelievable things to people, and particularly our hearts. So with that, I want to start and ask you, how does stress affect the heart? And is there good stress that we need versus the bad stress, such as exercise? And so there's a whole lot that you can say about this, I'm sure, but in general, how does stress affect our hearts?
It's so funny because there is such a thing as good stress, but when you say stress to anyone, they're like, what? There's nothing good about that. I loved watching the Olympics, over the last summer, and looking at those athletes at the top of the mountain. That's the good stress. Before an exam for my son, that's good stress. to get yourself revved up to be the best you can. But what happens is with chronic stress, we have a huge problem. But let me tell you about stress. This is the fight or flight response. This is what triggers us to be heightened, to actually react quickly. The sympathetic nervous system increases. And as that happens, our blood vessels clamp down, our hearts increase. But as chronic stress goes on, we have an increase of inflammation. And this is toxic to the arteries. So over time, this fight or flight stress response, this increase in these hormones that actually can increase blood pressure, increase cholesterol, and increase this inflammatory cascade that leads to damage to the lining of the arteries and can lead to plaque formation. Acute stress is okay, but I will tell everyone, you know when it's too much. You know when you've had enough. And when that happens, I promise you that these hormones are really causing problems, and getting them under control is possible. And that comes down to that 80% of the time there's something that we can do. There is something that we can do about stress. We can't change it. We cannot change the stress thrown at us, but we can change how we respond to it.
That's the key point. And COVID, this pandemic, threw that uncontrollable amount of stress at all of us. Did you see a difference in how women responded to that stress, or the impact of COVID stress, particularly on women?
I think that if any of us turned on any form of social media during COVID, you saw at least one woman saying, how am I supposed to be a teacher to my children and go to work and take care of the house and be everything? And, the reality is that women really got stuck in the crosshairs of who we are in life and what we have represented to so many different people. The reality is there is no such thing as a proper balancing act, and there is no such thing as a proper juggling act. We got to just squeeze it all in somehow and make it work. And during COVID, we found out we couldn't really squeeze it all in and make it work. It was too much at us. The intensity was insane. And so I believe that those women in that age that had those kids that they were taking care of and being schooling at home, 30s, 40s, 50s, 5 years from now, let's see what happens. I think there's going to be an increase in heart disease. And what we're seeing right now today is women less than 55 years old have an increased rate of heart disease compared to men. Less than 55 years old. These are women who we have traditionally thought of as being super healthy, really in the prime of their lives, and we're seeing an increase in cardiovascular disease.
Are there specific reasons, factors that you've identified, or is this just general, the stress and very hard to quantify?
So when we look at why heart disease develops, and this is in both men and women, there are major risk factors. There's high blood pressure and high cholesterol and elevated sugars, sedentary lifestyle, poor diets. All of these things affect men and women the same way. Those are the modifiable ones. And then, of course, we can throw in family history. Well, we're seeing in women, these younger women, an increase in these risk factors like high blood pressure, obesity, diabetes. Women are not taking care of themselves the way they need to. Why? Because of this stress, because of this juggling act that women had to deal with during COVID and even before then. That's really had an impact on their hearts.
Mm-hmm. So we know a lot of these statistics with the increased rates of obesity, and I think that you mentioned the high blood pressure, and that's one thing I want to talk a lot about because it is the silent killer. It goes undiagnosed for many. So women are good about getting their mammograms, maybe even their colonoscopies after 50. We don't do screenings for heart disease. Who really does check their blood pressure regularly? So what do you advise women to do in that realm of what are the annual screenings or checkups we can do?
So I want to tell you a little bit more about hypertension, because one of the statistics that is so overwhelming to think about is 50% of African American women by age 20 will have some form of heart disease, and it's usually in the form of hypertension. And so when we look at what that impact is of a 20-year-old, think about pregnancy, think about preeclampsia and gestational diabetes and all those horrible adverse outcomes of pregnancy. This is happening in this group of women in this population. So to your point, how do we get blood pressure checked? You would think that's a small, simple thing. And many women aren't going for what we call those well women visits. Who's going to get their blood pressure checked? Well, okay. Believe it or not, one of the craziest initiatives is that when women go to their OBGYNs, that they get their blood pressure checked. Because a lot of women go to their gynecologists, and wouldn't it be great to have a blood pressure check in a gynecologist's office? That should be standard. But for those women that do not get their blood pressure checked, the coolest thing now is we can go into a pharmacy around the corner and stick our arm in a machine and get our blood pressure checked. We can really get access to blood pressure checks in places that we never could before, like the pharmacy, like I mentioned, some stores have it. We can actually even get a blood pressure cuff in a pharmacy and do it ourselves if we wanted to. But everyone should have a blood pressure check at least once a year. It's critically important because if there's an issue, it's treatable. And if it's treatable, you don't have to get sick from it.
Right. I love hearing that. Again, empowering people, really realizing does not have to go down that path. The path of disease, I mean. Yeah, and that seems such a simple thing. That's a great takeaway of everything we're going to talk about today. Check your blood pressure, know your numbers. It really is that simple. You know all these scales now that are Bluetooth enabled and they check your body fat? I think we're headed towards the blood pressure as well. Not everybody has a cuff, but it is becoming more common at home.
We are. I think one of the things that happened at COVID is that we learned how to take care of people when we couldn't actually see them. And so I was sending blood pressure cuffs to patients all over the country. As everyone moved out of New York City, they were isolated, but I was able to get them different devices. Again, coming back to that technology piece, there are things out there to check our blood pressures that we can use to communicate with our doctors, that we can get advice and help from actually empowering ourselves to get the tools to use these things. And blood pressure is just one of them.
So with or without checking, I think it's most important to talk about what do we do? What do we do even starting today, men and women in particular, and these younger women, when they're listening and they're hearing, gosh, I don't even know if I have high blood pressure. I really want to take action now to mitigate the stress and the impact of all these life stresses on my heart. So what do I do starting now?
So you mentioned the phrase that we use with Go Red for Women, which is know your numbers. And the American Heart Association says know your numbers, and that means getting these things checked. And it's so simple to just make an appointment with your doctor and get your cholesterol checked and your sugars checked and your blood pressure checked, the basics, all of those risk factors that I mentioned. Talk to your family, find out your family history, take a real deep dive. And I always say, look at yourself in the mirror and really take a look at what you're doing, because that ice cream at midnight is not helping you. And unless you really do an accurate evaluation, I say become a journalist of your life and really see what you're doing and pay attention to it. That's the beginning. And then we have to figure out the stress piece and how is it affecting you? And is it causing you not to sleep? Is it causing you anxiety or depression, which are really very common when there's chronic stress? How is it affecting you? And then the next question is, what are you going to do about it?
Right. What are you going to do about it? I also want to talk a little bit more specifically about some human emotions when it comes to our heart health, because we all at some point do experience grief, loss, some forms of trauma. We all certainly deal with a lot of emotional stress that I know does take a physical toll on us. And I also think that this is downplayed or not even discussed. So in other words, we suffer heartache and heartbreak. I want to hear from your perspective and with your experience, how medically speaking does that emotional pain affect our heart health as well?
You know, it's really interesting because we are very clear about the connection between the mind and the heart. So much so that there is a disease, Takotsubo's cardiomyopathy, which is when the heart actually becomes stunned when it's under severe stress. This is actually more common in women, but it's sometimes called the broken heart syndrome. And it's called that for a really good reason. It occurs when there is a surge of stress hormones in the body that actually cause the heart to look like it had a heart attack. It becomes stunned and dilated and doesn't pump well the same way as if someone had a massive heart attack, but there are no blockages in the arteries and no problems like that. And in fact, there's usually resolution of it when the stress hormones calm down. Now, that doesn't happen often, but it happens. And the reason I bring it up is more because it tells us the profound impact that stress hormones can have on the heart. When we look at it less dramatically, those stress hormones can cause high blood pressure. They can cause high cholesterol. They can cause inflammation. And this causes problems to the lining of the arteries, which then leads to plaque, which then leads to heart attacks. And that's a problem.
I want to repeat that just for a moment, Dr. Suzanne, because people look at their diet under a fine tooth comb. They get so concerned about every morsel. Sometimes I have seen this, that the food they put in their bodies, and overlooking what you just said. I don't think anybody really has ever heard that stress can directly impact your cholesterol level as well.
Yes. It's so interesting. When I started this 20 years ago, I mentioned I was running a cardiac rehab center. So these were for people who already had heart attacks. And of those patients who already had heart attacks, we were focusing on exercise. We were focusing on diet, but we were also focusing on stress management through group support. And the reality is that at that time, we weren't supposed to talk about stress being a risk factor for heart disease. Could you imagine? That wasn't actually considered. But now research has shown that stress is not only a risk factor for heart disease, but it can also increase cholesterol. And it's so interesting the way that you bring it up, which is people are so focused on their diets to decrease their cholesterol. But if you don't look at the big picture of who you are you sleeping? Are you exercising? Are you managing your stress? What are you doing? Are you laughing? Are you resilient? Are you looking at the world optimistically? Believe it or not, all of these things are risk factors that can increase your blood pressure or cholesterol.
Or the lack of those healthy lifestyle habits. A lack of the good stuff is what I always tell people. I really do. I always bring that up because they focus so much on what they, quote unquote, should not be doing or should not be eating, instead of taking that, as you just said, that holistic overall look, that bird's eye view of your own personal life, your habits, yourself, and truly assessing, how am I managing my stress on a daily basis and supporting my overall health and functioning? The sleep, you mentioned laughing.
Yeah.
Who in the last 2.5 years had a belly aching laugh?
Right.
Maybe when they were binge watching some TV as they're eating, perhaps.
But just like I was saying, those stress hormones, that connection between the brain and the heart, do a little experiment. Smile, laugh. See if you can be miserable and depressed when you're faking it. It's hard because the same way that when you laugh, you release different hormones, happy hormones. And when you release those happy hormones, you actually feel better. I always say, find people that make you laugh. Don't hang out with those that make you sad because it's not helping your heart.
That is so true. People might have to rethink a lot of their relationships. And I don't mean that in a negative way. It really is. If you assess who's in your life, who's in your inner circle, do you have relationships that are really bringing you that joy and happiness, filling your heart, making your heart happy, right? We're sensitive creatures, and your interpersonal relationships are number one as far as for making and breaking things. I say people gain weight together. When I talk nutrition wise, we all need support and we need positive support, and there's also negative. So I like talking about all this because I think it's just too easy to not talk about the elephant in the room or various things, or it's a wake up call to, let's say it's the primary relationship in your life, and it's not saying, let's say it's a marriage and you're both feeling really unhappy. It's a call to action to make changes to improve, because I think there's always something positive, right? Where it's actionable, preventable, all of that you can do something about it.
Here's the thing about the heart. The heart is not just an organ. It is a metaphor of your life.
Yeah.
It's the essence of who you are. And so when you really start thinking about, I love the phrase you use, fill your heart. If you really start thinking about what fills your heart, what really is keeping you healthy. Now let's think about this from the organ side. Yeah. When you're healthy, your arteries dilate, your cholesterol, and when your arteries dilate, by the way, your blood pressure's down. When you're eating right and exercising and sleeping well and managing stress, for the most part, you can keep your cholesterol kind of low. We do have genetics behind us and some other issues, and I'm not saying that doesn't exist. But in the big picture, if you're holistically living this life where you metaphorically are filling your heart, chances are all these other risk factors are going to be in check.
Yay. You just made my heart happy. Just confirming what I believe and tell people. And it's true. And I think a lot of people need the permission to act on that. Does that make sense?
Yeah, because, I think there's this thing of, I don't know if this is true for everyone, but selfishness or like I have to do for others. I have to give. There's so much around it. A lot of guilt with people. Like I ate a chocolate cake. I'm a terrible person, or I missed exercise. I'm awful. Come on now. Like when people are the meanest to themselves, I'm just like, you're so mean. You would never be this mean to anyone else. Think about it. And I think that if we start paying attention to actually who we are in our lives, we can give ourselves permission to manage our stress. We can give ourselves permission to say no sometimes. We can give ourselves permission to have a little bit of cake. I mean, it's okay. It's not about
okay. Sometimes it's necessary, right? That piece of cake makes you happy. It makes you smile. It releases endorphins. It releases happy hormones sometimes, right? Putting it in perspective, and instead of all that shame and guilt and self-judgment, which we both know women do so much of. And I won't say that men do not. However, it's, in the many, many years of coaching and nutrition counseling I do, it is rare that a woman doesn't say something negative about herself, the self-judgment.
It's really interesting talking about these statistics surrounding women. I just talked about the unconscious bias. That comes from the system. But women themselves don't often go to the doctor and talk about their hearts because they feel like it's their fault sometimes. Because if they just exercise more, if they just ate better, if they just did the right thing, maybe they wouldn't get heart disease. And I'm going to say this very clearly to every woman out there listening. Not everything is your fault. And we do the best we can all the time. If we can do the best we can, that's going to be good enough. And sometimes bad things happen and sometimes we get sick. But I promise you, if you take care of yourself, your sickness would never, ever be as bad as if you didn't take care of yourself. That's when really bad things happen. I say to women going through menopause, you got to go through it like you're training for a marathon every day because it's not easy. And if you don't, you're going to come out with weight gain. You're going to come out with high blood pressure and high cholesterol because that's what happens. It's the natural progression. But we can fight against it. It's just a really long haul and it's not easy and it's kind of hard. But we do the best we can.
We do the best we can. And this is why we're talking about it and supporting one another. And I think a lot of women, again, in particular, live in this rather lonely place with all of that and don't speak up. And so we're here to tell them, really work to rid yourself of any guilt when it comes to your health. And it's the best thing you can do for your families, your loved ones, and obviously yourself and your health. But this is really so, so important to talk about. And I have to thank you. And, before we're not done yet, I just have to thank you for saying that, because again, giving the listeners, particularly women, that permission, people need it. It's really fascinating, isn't it?
I'd like to talk about the men for a second.
Yeah, sure.
The
men too. I'm not neglecting them.
No, and I'm going to tell you, in my practice, I run a women's prevention practice. 60% are women, 40% are men. I always say that men are allowed, just women have to come first and just hold the door for them, but they're allowed to come too. I've learned a lot about men recently. And, we're stereotyping. Let's say that's a fact right now. We are absolutely stereotyping. But I have seen waves of my men patients managing stress. And COVID dumped on them too.
Tremendous.
And so let's just say for the men, that stress is affecting you as well. And the women are trying to keep it together. Women tend to talk about it a bit more. The men that are holding this all inside, it's not helping you. This stress really has a huge impact on both men and women. And I've seen it in my practice. I see it in both sexes of patients I speak to. It's really been a very big deal and had a profound impact on everyone's health.
I do see it across the board as well. I completely agree. And I said that word isolation, and I agree with you on that too. I think you're getting at men tend to stay in isolation themselves. They're carrying so much responsibility. And again, it's not just men and it's not just women. We all have responsibilities, but I see what you're saying because I work with a lot of men who are running, as you too. And I wanted to ask you this question: when you're running a company and that business, you have employees, and all of a sudden your business essentially is turned upside down or, kind of goes away, and you had to lay off an entire workforce and things like that. It affects you emotionally, mentally, financially, everything. And people are still recuperating from all of that.
It's funny. I have to say this. I always used to joke around that more women started dying of heart disease in 1984. And that was because that was the first time women were in the workforce equally as much as men. And I'm like, yay, we broke the glass ceiling and got their disease too. Woohoo. And I feel a lot like that right now. There are a host of us women CEOs who are carrying that burden that, was traditionally male. But what happened during COVID was the women were going to work and taking care of the kids, and so it's sociologically interesting.
It is.
And we can talk about that for so long. Like the microscope that was put on our culture, I think, came out. So I think through that lens, I'm living the worlds of the typical masculine situation with the feminine part. And so I'm embodying both sides, I suppose. And so maybe that makes me more able to talk to both men and women in some ways. I think one of the things that I've learned, and I learned this as being a cardiologist throughout my life, is that there are things we can't control. And those things that we can't control, we have to figure out how to manage. And if I would say there's one thing that all of us need to learn more than anything is resiliency and how to be nimble and understand you can control what you can control. And that which you cannot control, you do your best. And during COVID, I had to furlough my team and figure that out and go through that. And it's devastating knowing everyone had families, and it's just painful. Got back as soon as I could, made up for it in any way possible, kept the team together ultimately, and was able to get back to the office and see patients as soon as I possibly could. So personally, I think that I try and maintain with that glass half full attitude that as bad as things are, it can't get worse. Or, if you hang in there long enough, it's only going to get better. You just have to hang in there. And how do we get there is really a mindset in a lot of ways, to almost trick yourself into believing every day, it's going to be okay. And that optimism actually has been associated with longevity. I am an avid exerciser. That's my sanity. I am also an avid laugher. I make sure to laugh all day long. I love making fun of myself in situations because things are really funny. And if you look at everything right now, they're kind of crazy. And if you don't laugh, it could really, really make you sad. So you got to figure out how to laugh. And I believe in finding something that helps you manage your stress. And for me, meditation has been a huge tool. I've done a lot of work with the David Lynch Foundation and meditation, and that's a big part of my life. That is extremely important. And the last is this idea of living with purpose. And I think that's the luckiest part of my life. Studies have shown that if you live with purpose and passion, you live a longer, healthier life. And I've definitely been here for a purpose. And as stressful as it is being CEO of a tech company and not having the background to do so, getting an MBA while on the job, I believe that we're all here for a reason. And if we figure out what that reason is, we actually live longer and healthier lives.
That's true. That relates to, we won't go into the blue zones. I love all of that information and those studies on populations that live the longest. And that is a key part of it, having that sense of purpose. You wake up every day. And what I love to do as well is helping people and making a difference in the world and actually saving lives, right? And helping people live longer, better, and, all of that little stuff.
All of that. But it really changes things, and it really changes your makeup. And when we talk about these things, it's really about these hormones. Which hormones are you going to release? The stress hormones or the happy hormones? Mm-hmm. And it's a mindset. It's a mental shift. It's all of those things. So it matters.
It sure does. And you without me asking, you actually answered essentially my last question about how do we proactively take care of our hearts and what do you do personally? And I just want to reiterate the meditation, the very, very amazing effect of meditation. And I talk about this in many of my podcast episodes. I teach this to people. I like to give them the tools and resources to bring these lifestyle habits into their own lives. And I love hearing you say that and to speak to that, because when we're talking about our mental health, our emotional health, it's very hard nowadays to talk about, and we can, because now we're in 2022 and you and I have been in our fields for many years where people would have looked at you like you were growing horns out of the top of your head if you did talk about meditation and even yoga and stress management. And now it is more than mainstream. It needs to be incorporated into all of our discussions about proactive and holistic health and, what can we do personally on a daily basis. Smiling, laughing, and meditating don't cost anything.
Right.
Right?
The most amazing thing was that the American Heart Association came out with a scientific statement that talked about the benefits of meditation on the heart. I thought I was going to pass out. It's 20 years ago. I wasn't allowed to say that stress was a risk factor, and we've come a long, long way. So when people are really trying to figure out what it is to keep their hearts healthy, we know the basics. We know to eat right and to exercise and sleep and all those things that you talk about. But what we really need to focus on, as we've been talking, is really this viewpoint of ourselves holistically in a way that we are nurturing our hearts and taking care of ourselves, not just by getting our blood pressure checked and our bloods checked, but by taking care of ourselves by mitigating our stress, dealing with the world and where we are today. And that's part of that is the stress management. And you know what? Meditation is just one part of how we can do that.
It is. And thank you. Thank you for bringing up so many really life-saving perspectives and this information that educates everybody, because the awareness, the education, and empowering all of our listeners. I know by this discussion, we actually, as a side effect, are saving lives. I think, can we share that? I believe so.
I hope that the people that are listening that need to hear this are listening on a really deep level and actually might decide to make some changes in their lives that can change their lives. And that would be tremendous. And that's why we're talking today. So I thank you so much for having me and being part of that journey of saving lives and changing lives, because that's why we're here, right?
That's why we're here. Yes. Thank you. I could continue this conversation for a very, very long time. In general, though, I have to be cognizant of our time. And there's one very important question, though, that I ask all of my guests, Dr. Suzanne. What is one thing you are grateful for today?
Oh my goodness. I really am grateful to say that I am sort of living this dream. And I feel like my purpose on this planet has been to change healthcare for women and to empower women to live longer and healthier lives. And in the middle of creating something that's actually going to do that. And I have a team of people around me that are brilliant and passionate and said to me, okay, we'll do it with you. And if there is anything that I could be more grateful for is having that sort of support and the excitement and the ability to do it.
That's fantastic. That is so inspiring. I really got goosebumps hearing you say that. The world needs it. Thank you. I can't thank you enough, actually. And
thank you so much. Thanks for having me. It's so great talking to you. Keep doing the good work you're doing.
Thank you. Before I forget, I apologize. I do want to tell listeners, where can they find you? Where can they find more information about your company?
DrSuzanneSteinbaum.com. And the information is there. It's hearttech.health is also the website, but you can find me through my own personal website, Dr. Suzanne Steinbaum.
Fabulous. And hearttech.health. The .health is a new one, I think, for most people. Thank you again. This was really invaluable and truly inspiring and empowering.
Great. It was great being here. Thank you.
Thank you for taking the time to join me and listen to this episode. Listeners can find more information and also subscribe to the Sense of Wellness podcast at www.ccphp.net/SENS/podcast. That's www.ccphp.net/SENS/podcast. This show is brought to you by Castle Connolly Private Health Partners. We are a concierge medicine organization that partners with exceptional physicians to deliver an unrivaled healthcare experience while also empowering our members to achieve their optimal well-being. Be sure to listen in next time to the Sense of Wellness podcast, and remember, simple daily habits matter most.